Wellness for Life is brought to you by Perham Physical Therapy, Sanford Health Clinic and Same Day Surgery Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership.
Hi, I'm David Gothenburg, Gothenburg Chiropractic here in Pelican Rapids, and today what I thought we'd talk a little bit about is one of the more common things we see is people with varying degrees of arthritis, whether it's in a joint or neck and back. So the question is can we help people with arthritis? The answer to the question is yes. And so really, before I can answer that question, I want you to understand what a healthy vertebrae looks like. We'll look at a couple examples of unhealthy vertebrae, but in this case we have two opposing vertebrae with a very healthy disc space. As chiropractors, we're concerned not only about the position of one vertebrae as it relates to the one below and above, but we're also concerned about its movement. Now, things that could affect movement might be tight muscles. The problem may be more long-standing, involving other connective tissue like ligaments. And then what chiropractors are very good at is correcting alignment. How does one position, one vertebrae sit compared to the one above or below? What are some factors that can predispose one to arthritis? Well, there are things like genetic or family history. Another common cause would be injury or your lifestyle. What do you do every day? Or things that we do repetitively that just over time cause a wear and tear effect. So there's a lot of different causes, but we believe that with appropriate care, we can do things to not only slow, but in some instances, reverse some of those early degenerative changes. So if this represents a healthy segment, this would be a representation of early degenerative changes. The cushion, the disc, has begun to thin. And in this case, this is more advanced, where the body now is beginning to form bony bridges or bone spurs to fuse the two vertebrae. In the example right behind me, we can see a textbook normal cervical spine, neck, and we can see as the progression to something that is completely unhealthy, where the vertebrae have fused one to the other. Now, up until this point, I really haven't talked about what we do. I can tell you that medically, the treatment has always involved rest, elevation, and medication. With good chiropractic care, where we emphasize on restoring not only position and motion, we can do things to slow or stop the progression, and in some cases, reverse the progression. We want to get the vertebrae moving freely, just like the knee. Once the knee becomes stiff and doesn't move well, the arthritis accelerates. We want to stop the acceleration process. In addition, you can do things that feed the joint nutritionally, glucosamine or supplements that support connective tissue. We want to keep people moving. That keeps the joint and cartilage healthy. Sometimes we might recommend things like a teeter swing or traction. Closing, I just want to say that if we simply excluded every patient with arthritis, we wouldn't have very many people to treat. So there is hope, there is a chance for improvement virtually at any and every condition. In closing, I just want to thank you, and remember, we're in the apple season. Eat apples.
Coming up on Wellness for Life.
Hi, this is Don Perrin, Jenny Field. We're pharmacists at Pelican Drug Health Mart in Pelican Rapids. Today we're going to talk about 5 end-of-year tips. As the days keep getting shorter, does it feel as though there are fewer than 24 hours in a day? With the holidays right around the horizon, there's so much to think about and so much to do. Here are a few end-of-the-year reminders to make sure your health and your pocketbook doesn't get the short end of the stick.
The first thing you can do is get your flu shot. If you're like many people, getting a flu vaccination can easily slip your mind. But a flu shot is too important to get bumped to the bottom of your priority list. Every flu season is different and every person responds to the flu in a different way. The flu can lead to hospitalizations and even death. The flu season often begins in October, so there's no better time than the present.
Plan for Medicare open enrollment. Every year, the open enrollment for Medicare is October 15th through December 7th. This is when you can change your health plan and prescription drug coverage. You can get more information here or call 1-800-MEDICARE or go to www.medicare.gov. You'll find a wealth of resources to help you compare hospitals, doctors, drug plans, and other healthcare services. But if you need more help making comparisons and choices, we can help. Just ask.
Another thing you can do is switch to generics. Generic medications are identical to brand name drugs in dosage, form, safety, strength, route of administration, quality, performance traits, and intended use. Here's how they're different. They're usually much less expensive than brand name drugs, and not all medications have a generic equivalent or for a brand name drug. One way to find out is to go to drugs at FDA, or we can also talk about this. Switching to a generic medication might put a few, or maybe more than a few, extra dollars back in your pocket. Wouldn't it be nice to have a little extra money for the holidays, or to use however you choose?
Use it or lose it. Do you have a flexible spending account, FSA they call it? This is a special account you put money into to pay certain out-of-pocket health costs. That might include co-payments, deductibles, drugs, and other healthcare costs. Limited to $2,550 each year, this money is not taxable. If you have an FSA, now is the time to use up your health benefit dollars, or you'll lose them. Schedule eye or medical checkups before the end of the year. Some employers make allowances though, so check to see if you have a grace period for using up the money or if you can carry over a limited amount of funds to the next year.
Final thing you can do is schedule a tune-up. Why not schedule a meeting with me or Don to see if your medications are working as well as they can for you? We can help come up with ways for you to remember to take your drugs and to order refills before you run out. If you're not happy with your drug side effects, we can work with your doctor to adjust the dose or find a substitute. There's no need for you to suffer in silence.
Thank you for joining us today. Have a happy and healthy holiday season.
Thank you for watching Wellness for Life. Brought to you by Purim Physical Therapy, Sanford Health Clinic and Same-Day Surgery Center, Amy Lundberg, Fitness for the Soul, Gothenburg Chiropractic Clinic, Pelican Drug Health Mart, Mojave Ottawa Community Action Partnership,